Nanoparticles, sir, and other faculty members, scholars, and students are welcome to this Viva's examination of Mr. Vaidana. He is working with me on the title of degree synthesis of nanoparticles, silver nanoparticles, and it's a therapeutic role in colorectal cancer. Today, he is going to defend his thesis and clarify the questions asked by the expertise and other members present over here and also the online. So I welcome all the members to be present here, and I request Mr. Vaidana. Sir, would you like to speak, sir? Krishna Reddy, sir?
Thank you, Dr. Venkatramana Reddy, the supervisor of today's PhD Viva OC, the external member, renowned scientist, and the principal of SVU Science College, and the dynamic personality of Department of Zoology, Professor Srinivas Reddy Garu. Though he is very busy, in spite of his busy schedule, he is ready to be here due to certain pre-committed activities. He came online. We are very much thankful to you, sir, and I request him to listen, and if there is any good suggestions for the improvement of his postdoctoral research work, maybe some suggestions will be. We are hoping from you, sir. I now hand over the mic to Dr. Venkatramana.
Okay, thank you, sir, for your introductory remarks. And I ask, shall I proceed, sir?
Yes, you
okay.
can proceed.
Vaidana, please go ahead and present your work.
Open again,
Good afternoon to all delegates and students. I am R.N. Vaidinath, doing PhD under the supervision of Dr. N. Venkatram Reddy. Title of my PhD work, Green Synthesis of Silver Nanoparticles and its Therapeutic Role in Colorectal Cancer. These are the objectives. Objective 1 is green synthesis and characterization of silver nanoparticles using Eucalyptus globulus leaf extract. The second one is the investigation of anti-cancer activities of biogenic silver nanoparticles in human colon cancer cells. In third one, evaluation of biogenic silver nanoparticles on rat model of dimethyl hydrogen induced colorectal cancer. Before entering into the objectives, I would like to brief introduction about cancer. What is meant by cancer? Cancer means abnormal cell divide without control and unable to invade the other tissues through the blood and lymphatic system. Colorectal cancer is cancer begins a small growth in colon which progresses very slowly into cancerous tumor. Colorectal cancer is the third most common cause for death in both women and men. These are the stages of colorectal cancer. In stage 0, small tumor on the inner layer of the colon. In stage 1, has passed into the inner layer of the colon. In stage 2, the cancer has grown into the wall of the colon. In stage 3, the cancer has invaded the nearby lymph nodes. In stage 4, the cancer cells enters into the distinct organs of the body, such as liver or lungs. These are the various risk factors of colorectal cancer, family and personal medical history, lifestyle and others. These are the various symptoms of colorectal cancer: constipation, diarrhea, blood in stool, narrow stool, abdominal pain, and unexplained weight loss. These are the currently available screening methods for the colorectal cancer: colonoscopy and visual colonography, sigmoidoscopy, double contrast barium enema, digital rectal examination. Colorectal cancer, various approaches for the treatment, conventional approaches and novel approaches. Due to conventional approaches has some side effects, novel approaches are the emerged. So in novel approaches, target therapy was more prominent. So we choose in target therapy nanoparticles. These are the various applications of silver nanoparticle: medical industry and sensor industry, anti-pathogen activity, and drug delivery. Due to some drawbacks in chemical synthesis, we approached green synthesis of silver nanoparticles. Green synthesis advantages: environment friendly, cost effective, easily scaled up for large synthesis of nanoparticles. No need to high temperatures, pressures, energy and toxic chemicals. Plant extracts are rich in functional molecules such as phenolic compounds with high antioxidant activity. This is the Eucalyptus globulus plant classification. Family is Myrtaceae, common name is Nilagiri. These are the major metabolites present in Eucalyptus globulus: 1,8 cinnilion, alpha penin, L pintocarval. These are the various advantages of Eucalyptus globulus leaves. It acting as an anti-diabetic, anti-cancer, and antimicrobial, antioxidant, and antiviral, and anti-inflammatory. So we choose the silver nanoparticle synthesis purpose, Eucalyptus globulus leaves. Objective 1: green synthesis and characterization of silver nanoparticles using Eucalyptus globulus leaf extract. These are the various techniques we used in objective 1: green synthesis of silver nanoparticles using Eucalyptus globulus leaf extract, characterization through the UV spectroscopy, XRD diffraction, nanoparticle tracking analysis, and FECM, transmission electron microscopy, and dynamic light scattering analysis, and FTIR. Green synthesis of silver nanoparticles using Eucalyptus globulus leaf extract. Initially, we taken 10 grams of leaves in 100 ml of water, then boiled with 5 minutes at 100 degrees temperature. The filtrate was collected by using 0.2 micron syringe filter. Then we add the 1 millimolar silver nitrate, 1:9 ratio. Then we kept in orbital shaker, 200 rpm, 50 degrees centigrade, 30 minutes in dark. Then we centrifuged 13,000 rpm, 20 minutes. Then pellet was resuspended with milk water. Characterization of AGNPs. Here we observed AGNP formation was observed by changing in color from red to brown, starting from 0 minute to 140 minutes. Here we observed maximum peak at 430 to 450 nanometers. Characterization of AGNPs. Here we observed the XRD spectra analysis for AGNPs. The diffraction pattern proved the crystallinity and purity of AGNPs. Nanoparticle tracking analysis. We observed average size of AGNPs in 21 nanometer. In transmission electron microscope, the AGNPs was spherical in shape, and average particle size was 15 to 25 nanometers. We observed. In FECM, increased size of nanoparticles was observed. So it presence of biomolecules on the surface of AGNPs. Hydrodynamic particle size distribution of AGNPs through the DLS. The size of nanoparticles in DLS always appeared superior to the TEM analysis because of the solvent layer present around the nanoparticles. Biogenic silver nanoparticles having zeta potential of -5.5 millivolts, which could play an important role in their biological activity. From FTR, we observed various functional groups These groups acting as the capping agents of on AGNPs. Objective 1 summary. UV spectroscopy recorded absorption peaks between 400 nanometers, 430 nanometers. It indicates the formation of silver nanoparticles. From XRT results, concluded that synthesized particles are AGNPs. Nano tracking analysis and TEM confirmed the size of AGNPs average 20 nanometers. From FECM, the presence of biomolecules on the surface of nanoparticles and these molecules capping the nanoparticles. FTI spectra of green synthesized silver nanoparticles confirmed that various metabolites present on the surface of AGNPs. Objective 2. Investigation of anti-cancer activity of biogenic silver nanoparticles in human colon cancer cells. These are the various techniques we used in Objective 2. In vitro cytotoxic assay, colony formation assay, transmission electron microscopy to check the endocytosis, cell cycle analysis, mitochondrial membrane potential assay, reactive oxygen species production assay, apoptosis analysis, quantitative reverse transcription polymerase chain reaction, and Western blot. We have silver nanoparticles. We have at what concentration silver nanoparticles will be effect on cancer cells. For that we treated that cancer cells with different concentration of silver nanoparticles. Here we observed control cells looks like polygonal shape with sharp boundaries. AGNP treated cells showed decreased number of cells with irregular shape and increased apoptotic morphological changes in dose dependent manner. We performed MTT assay to know the cell cytotoxicity of AGNPs. This is the procedure. Cytotoxicity of AGNP assay through the MTT. Human colon cancer cells, 50% inhibition proliferation was observed at 1 mg per ml AGNP concentration. Here we have doubt these silver nanoparticles effect on cancer cells or normal cells. For that we treated the human embryonic kidney cells. Here we observed human embryonic kidney cells were not affected with 10-fold higher concentration of AGNPs, where HCT cells are affected. Lower concentration, these particles are effective especially to cancer cells, but not to normal cells. We performed the cell proliferation assay. This is the colony formation assay procedure. Cell proliferation, effect of AGNPs on colony formation, HCT cells. Here we observed cell proliferation was reduced in dose dependent manner. Here we used positive control 5-fluorouracil. Transmission electron microscopic, and this is the procedure. Transmission electron microscopy of cells treated with AGNPs. Here we observed control cells dividing nucleus and mitochondria. In treated cells, we observed number of vacuoles are increased and disintegrated the nucleus. And in 5 treated cells, disintegrated nucleus was observed. We analyze the cell cycle analysis at what stage cells will be arrest the silver nanoparticle. This is the procedure. Cell cycle analysis through the flow cytometry in AGNP treated cells. AGNPs are arrest the cells at G2 and M phase. 5FU arrest the cells at G0 and G1 phase. Live cells and mitochondrial membrane potential in AGNP treated colon cancer cells. Here we stain the cells OHS stain, which is bind in live cells were appeared in blue in color. We stained with rhodamine 123. It measures the mitochondrial membrane potential, where appeared in green in color. AGNP treated cells, we observed less number of live cells and mitochondrial membrane potential. Reactive oxygen species estimation assay. For reactive oxygen estimation assay, we using DCFDA reagent. This is the procedure. RAS estimation by fluorescence spectroscopy and RAS estimation by flow cytometry. Estimated RAS both fluorescence spectroscopy and flow cytometry. AGNP treated cells produced more RAS. Apoptosis assay. Apoptosis was measured by using Annexin V FITC staining kit. This is the procedure. When compared to the we observed when compared to the control cells, all treated cells shows the higher number of early apoptotic and necrotic cells. We performed the RT-PCR, which genes are responsible for the apoptosis. This is the procedure. mRNA expression of apoptosis genes in AGNP treated cells. Here, P53 gene majorly plays a role in apoptotic pathway. BAX and BAC genes are mediators of the apoptosis. Here we compare to the control cells. AGNP treated cells shows the fourfold increased expression of P53. BAC twofold expression of BAX and BAC genes are observed. Yeah. We performed the inflammatory genes like NFKB and COX genes. These are the major inflammatory genes for NFKB and COX. These are majorly present in inflammatory genes which are responsible for the transition of inflammation to cancer. These genes are significantly reduction expression of these genes were observed in AGNP treated cells compared to control cells. We also analyze the stem cell marker genes. These genes are responsible for the metastasis of cancer. These genes significantly reduced expression of stem cell marker genes were observed in AGNP treated cells when compared to control cells. We performed Western blot for the protein for the measure of protein concentration level. Western blot analysis of apoptosis and inflammatory proteins. If apoptosis will be occurred, cleaved part 1 and caspase 9 protein concentration also increased. Here we observed increased concentration of protein in dose dependent manner. Vaccine protein concentration also increased in dose dependent manner. In COX2 and NFKB protein concentration will be decreased in dose dependent manner. This is the graphical representation of AGNPs. AGNPs are enters into the cancer cells through the endocytosis, disturb the nucleus and mitochondria. It produces the more RAS, increase the apoptotic genes, decrease the anti-apoptotic and inflammatory as well stem cell marker genes, and also protein concentration level. Finally, cell was undergoing to apoptosis. Up to here, we published in Cluster Science, Journal of Cluster Science, Impact Factor 3, Objective 3. Evaluation of biogenic silver nanoparticle on rat model of dimethyl hydrogen induced colorectal cancer. These are the various techniques we used in third objective: colon cancer induction, treatment and assessment of in SD rats, histology, superoxide dismutase and catalase assay, ELISA to detect TNF alpha and IL-6 cytokine levels, and RT-PCR. Colon cancer induction and treatment. Here we used SD rats with 6 weeks of age group. In each group we kept 6 number of SD rats. These are the groups: control group, DMH group, 5FU group, AGNP group, 5FU plus AGNP1 group, and 5FU plus AGNP2 group. In control group, we given normal saline up to 15 weeks, each weekly once. In DMH group, we given DMH weekly once up to 15 weeks. All other groups we given DMH weekly once. Second week onwards, treatment was started. After 15 weeks completion, we sacrifice the animals, collect the colon tissue, blood and lung and liver. These are the macroscopic observation of colon tissue. In control colon looks like normal. In DMH colon we observed 2 large tumors and a few small tumors. In 5FU treated we observed one large tumor and 2 small tumors. In AGNP treated colon we observed less number of tumors. AGNP plus 5FU plus AGNP1 and 5FU plus AGNP2. AGNP2 we observed very less number of tumors and its size also negligible. We calculated all tumors drawn the graph, and compared to DMH group, all treated groups has significantly reduced the tumor number. In second combination, the number of tumors are very much reduced compared to the other treated groups. We stained HND staining at adjacent to tumor, colon and lung, liver. This is the procedure. In HND staining, when compared to the control DMH group, we observe a high number of inflammatory cells. When compared to all other treated group, we observe less number of inflammatory cells. In lung, we observed when compared to control group, DMH having high number of inflammatory cells. When compared to DMH to all other treated groups, we observed less number of inflammatory cells. In liver also, when compared to control group, in DMH group having high number of inflammatory cells. When compared to DMH group, all other treated groups, we observe less number of inflammatory cells. Superoxide dismutase assay, this is the procedure. Detection of SOD activity in serum and colon homogenator. In compared to the control group, DMH group has a low SOD activity both in serum and colon tissue homogenate. In compared to DMH group, treated groups has significantly increased the SOD activity. So we start program. Right.
There was a technical problem. Please be online. We will resolving the problem.
Detection of catalase activity in serum and colon homogenate. When compared to control group, DMH group has low catalase activity both in serum and colon tissue homogenate. When compared to DMH group, treated groups has significantly increased the catalase activity. We performed ELISA to measure the TNF alpha and IL-6 cytokine levels. TNF alpha and IL-6 cytokines are majorly present in tumor microenvironment. Here we observed in serum compared to control group, DMH group has significantly high concentration of TNF alpha and IL-6 levels were observed. When compared to DMH group, treated groups have significantly reduced the concentration of TNF alpha and IL-6 observed. In second combination, TNF alpha levels are very much reduced compared to other treated groups. In detection of TNF alpha and IL-6 cytokine levels in colon tissue homogenate. In colon tissue homogenate, when compared to control group, DMH group has significantly high TNF alpha levels and IL-6 levels was observed. When compared to DMH group, all other treated groups have significantly reduced concentration of TNF alpha and IL-6 was observed. In second combination, group levels were very much reduced when compared to all other treated groups. Yeah. We performed the RT-PCR when compared to the control group, DMH group has 6-fold increased expression of COX-2 and NF-κB was observed. When compared to DMH group, significantly 4-fold decreased the expression of COX-2 and NF-κB was observed in treated groups. TNF alpha and IL-6 in colon tissue homogenate when compared to the control group in DMH group, 10-fold increased expression of TNF alpha and 20-fold higher expression of IL-6 was observed. When compared to DMH group, 9-fold decreased expression of TNF alpha and 15-fold decreased expression of IL-6 was observed in combination treated groups. CD26 and CD133, these genes, when compared to the control in DMH group, 4 to 6-fold increased the expression of CD26 and CD133 was observed. When compared to DMH group, 3 to 4-fold decreased the expression of CD26 and CD133 was observed in combination treated groups. LGR5, when compared to control group, in DMH group, 14-fold increased expression of LGR5 was observed. When compared to DMH group, 12-fold decreased expression of LGR5 was observed in combination treated groups. Objective 3 summary. Tumor incidence and volume was increased in DMH group. When compared to DMH group, treated groups AGNP and 5FU plus AGNP1 and 5FU plus AGNP2 showed the significant reduction in the tumor number on colons of rat. When compared to all treated groups, 5FU plus AGNP2 showed a very significant reduction in the number of tumors on colons of rat. When compared to DMH group, inflammatory cells were reduced in combination group. In combination group, metastasis was not observed. A minimal inflammatory cells were observed in lungs and liver compared to DMH group. In 5FU plus AGNP2 treated groups has extremely significant SOD activity and catalase activity both in serum and colon tissue homogenate. AGNP combination with 5FU suppress the TNF alpha and IL-6 cytokine production in DMH induced colon cancer. AGNP combination with 5FU amyloid, the colon cancer in rats by reducing the COX2 and NFKB expression and also stem cell marker expression. Conclusion. Green synthesis of silver nanoparticles using eucalyptus globulus leaf extract are stable, having various metabolites on the surface of AGNPs. Green synthesized silver nanoparticles significantly inhibit the colon cancer cell proliferation in vitro through the inhibiting COX2 and NFKB pathway. AGNP combination with 5FU amyloid the colon cancer in DMH induced colon cancer rats. AGNP combination with 5FU may be potential treatment for colon cancer. These are the workshops and seminars I attended. These are my publications. Thanks to my family members. Thanks to my research supervisor, Dr. N. Venkatram Reddy, for continuous his supporting. And thanks to Department of Zoology, head of the Department of Zoology and faculty members of Department of Zoology. Thanks to Professor Krishna Reddy sir, Dean, Faculty of Science, YVU. Thanks to Dean, Faculty of Science, YVU. Thanks to DST and DVT for financial support. Thanks to Professor Pallu Reddenna, School of Life Science, for providing of lab space. Thanks to Dr. Tummuru Murali, Managing Director, Vicho Biotech, some of the work carrying on Vicho Biotech. Thanks to my external expert, M. Srinivas Reddy sir, Department of Zoology, SV University. Thanks to L. Dakshani madam. Thanks to Dr. C. Madhav Reddy sir. Thanks to my friend Parshuraman, Wales University. Thanks to students and non-teaching staff and my family and all my friends. Thank you.
Okay. Sir, Professor MS, sir. Now he has completed his presentation.
Now the topic is open for discussion.
So there were two questions of the faculty. Proceed with the questions, sir. First, we will go for
అవును అవును అవును
Now the
ఇది
examiners has some pointed out. చూడండి ఒకసారి వెంకటరామరెడ్డి గారు.
పనిలే ఉంది కానీ హాస్టల్ ఇది ఇక్కడ ప్రాక్టికల్స్ అయిపోతాయంట అందుకని వదిలేస్తున్నారు ఇది అకాడమిక్ కన్సల్టెంట్ వాళ్ళ కోసం పెట్టా కంప్సైల్ ఏమైనా పని ఉంటే తీసుకొని కాలేజ్కి వచ్చింది ఫ్యాకల్టీకి 16th క్లాసెస్
Please ask the question, sir.
క్లాసెస్ ఈ రోజే లాస్ట్ పంపిస్తాను
వెంకటరామరెడ్డి ఆ రెండు queries ఒకసారి అడగరా?
Yes, sir, that's what he was.
చిన్న డౌట్ వచ్చింది సార్
He has put in the slides.
కాలేజ్ ప్రోగ్రామ్ క్లాస్ వస్తుంది సార్
Professor Srinivas Reddy garu, that question pertain to nanotechnology, nanoparticles.
Yes.
What is the stability of the synthesized nanoparticles?
Sir, now he displayed, sir.
రామరెడ్డి క్వశ్చన్ వచ్చేసి మీ క్యాన్సర్ దీనికి సంబంధించింది కాదు, నానో పార్టికల్ సంబంధించింది.
అవునా సార్?
You can answer, but you can state that based on that your analysis is there. Ante, that's all. Is not the big query which is not detracting the PhD thesis value.
Okay.
Okay, well, right now, just go ahead with your questions.
What is the stability
Both
of
questions are.
సరే మా
Second, somebody is asking. Please ask.
డెలివరీ
No, sir, he's explaining the question.
what is the stability of the synthesized nanoparticles? Did you analyze it? If the stability is less, what is your approach to improve the stability of AGNPs? Yes. Answer yes. Our nanoparticles are stable. We studied up to 6 months and performed zeta potential and TEM analysis repeatedly. We got consistent results. In future studies, we used ML sphere to increase the stability of nanoparticles. One of the previous study proved that water-soluble organic compounds present on eucalyptus leaf extract are mainly responsible for the reduction as well stabilization. Second question.
Okay.
Second question, why you choose the selected plant for the synthesis of nanoparticles? Answer, sir. Inflammation plays a major role in colon cancer progression. Our focus of study is to use plants having anti-inflammatory as well anti-cancer activity. For the preparation of nanoparticles, in the present study, we used eucalyptus globulus leaf extract because it possesses the both properties. In addition to that, water-soluble organic compounds present in this plant stabilize the nanoparticles.
అందుకని మనకు ఆల్రెడీ చాలా వరకు కాంపిటీషన్ నాలెడ్జ్ ఉంటాయి. అదేలా ఇస్తారేమో చెప్పి
నాకు రిజిస్టర్ కూడా ఏం చెప్పలేదే.
వెంకటరామరెడ్డి.
నా
So వెంకటరామరెడ్డి,
Sir,
in the absence of any questions, shall I conclude?
great.
yeah, if there are no questions from the scholars and other faculty members. Any questions from the faculty members who are there in online?
I have not a question, is a compliment.
No, compliment should be given by external expert, not from the internal members.
Thank you, sir. Thank you very much for your answer. However, it is I am very happy to say that the nanoparticles, what the question raised by one of the subject expert adjudicator, is question really he is using the nanoparticle as an application. He is not using the nanoparticle as the base research activity. So hopefully that once we ask the questions, we have to be much better. Okay.
Thank you.
But however, this thesis is extremely well and well formulated.
మీరు చెప్పకూడదు, నేను
The
చెప్పాలా?
guide, the guide, Dr. N. Venkatram Reddy and the student R. Narasimha, they have done extremely well. And the Department of Zoology is one of the vibrant department and young department compared to good old other departments. But however, it is above par with the other departments. In Yoga University, we have 29 academic departments and 33 programs we have. So among them, it is one of the
Best.
best department, and it is doing lot of service to the
University academics.
mankind through cancer research, and also the other faculty members are also engaged with different types of research, and among them Ram Reddy is one of the potential researcher, and he is doing well, and hope that he will continue at least for another 1 decade to 1.5 decade without going back. Uh, and I wish the student R. Narasimhan have the bright future in future endeavors. Now I request the external examiner, Professor M. Srinivasan Reddy Garu, to conclude the today's open viva OC examination. Thank you, sir.
Thank you, sir. Thank you. Let me first congratulate Narasimha for the presentation.
Thank you, sir.
The presentation is very nice, lucid, and it is quite understandable to all the, not only to the faculty members and also the student community. And I congratulate Venkatram Reddy for taking up a good aspect pertaining to the colon cancer and picking up the right materials in the form of phytomedicine that will cure. Lot of phytomedicines are being available right now in the Sheshachalam Hills, and the researcher has taken up the right plant which is widely available in our area for prevention of cancer. Though several researchers has identified the nature of this particular plant, but the researcher and Venkatram Reddy has done quite a commendable work in pursuing the material that is being present in the form of the phytomedicine that is specifically acting at the cellular level. All the materials you picked up, they rightly, specifically acting at the cellular level, which were being monitored through histological evidences. That is very commendable. And moreover, the histological evidences are in association with the giving or using a lot of sophisticated equipment, which will be very nice. So, in conclusion, the results you obtained at the cellular level are being ratified by using the technologies, especially using of the highest sophisticated technologies, which will ratify the results which you have. So I congratulate the researcher and Venkatram Reddy for their commendable work, really. And moreover, you have chosen a problem which is of very relevant to the present community. That is very relevant. So these results which will be very useful to the researchers in the future years, and also for the doctors who are preventing or we are working on the field of cancer. So I once again congratulate Venkatram Reddy and the student for picking up a right problem in the right area and in the present context. So on behalf of myself and the committee, we unanimously recommend Narasimha to be called as Dr. Narasimha from today onwards, and definitely it will be a feather to Dr. Venkatram Reddy's cap. So I thank all the universities, my friend, brother, Dean Faculty of Sciences, Professor Krishna Reddy Garu, and also my friend Venkatram Reddy Ganapalla, Dr. Venkatram Reddy Garu,
Glamour boy కదా కనపడ్డా.
Venkatram Reddy Garu, and
బాబు నేను పని మీద ఉన్నాను బా.
Dr. ATV Reddy, and
meeting
other
జరిగినా బా,
Anuprasanna and all the other faculty members. Venkatramana and all the faculty members for giving me a wonderful opportunity to have an interaction with you.
ఎక్స్ప్లెనేషన్ అడుగుతా.
So I thank one and all, and also
నో ప్రాబ్లం కాదు,
the
ఫస్ట్ టైం కాబట్టి
Vice
నేను
Chancellor
పిలిచాను బా.
for picking up me as an external examiner. So I thank one and all for that. I congratulate both Venkatram Reddy and the student right now. Thank you.
ఉన్నారు, ఒకరిద్దరు ఉన్నారు డిపార్ట్మెంట్. అది కూడా
Sir, good afternoon, sir.
నువ్వు హెడ్స్
Good afternoon, Amma. Good afternoon, Amma.
Good afternoon, sir. బాగున్నారా?
బాగున్నాం.
Hello.
Good afternoon, sir.
Thank you very much for taking your valuable time and despite of your busy schedule, you make it convenient and
Hello?
did it successfully.
Hello?
Thank you very much. Thank you very much, Professor Krishna Reddy Garu, Dean Faculty of Science, for thank you very much. And Ravi Prasanna, you want to say something?
Sir, congratulations to both of you, sir.
And thank you very much. Thank you. Ramana sir.
Okay, sir.
Sir, good afternoon.
MSRs are asking where is Ramana sir in the medicine. There are nobody's there. They are attending.
Sir, I'm on leave, sir, today.
So thank you very much, Professor M. Srinivasa Reddy sir, for your presence and recommending the candidate for one of PhD. So now I conclude this. I thank every faculty member who is attending online and also presenting here. The head department of zoology, Professor Krishna Reddy sir, the dean faculty of sciences, and other students, research scholars presenting over here. I thank everybody for making this committee presentation successful. Thank you, sir. Sir, I will send the communications for signature and other things, sir. You are on mute, sir.
You can send it through ATV.
Okay, sir.
I will affix my signature and send it back to you through ATV.
Thank you, sir.
So once again, I congratulate the student and Venkatram Reddy for the wonderful effort that I have put in for this wonderful event. Thank you, Anandal, for the opportunity given to me.
Oh, right, sir. Right, sir.
Okay, thank you.
Srinivas Reddy garu.
Thank you,
afternoon,
thank you. Good afternoon, yeah.
Sir, Krishna Reddy garu, sir. Good afternoon. Vaidhanath, all the best. Congratulations.
Thank you, sir.
Vaidhanath, congratulations to you and your guide, Venkatram
Thank you,
Reddy. Okay. Very good.
Okay, Venkatram Reddy.
Okay, sir. Signing off, sir.
Thank you. ATV good చెప్పండి. ATV good చెప్పండి.
Thank you.
కాదండి
చెప్పండి.
ఎక్స్టర్నల్ అడ్జుడికేటర్ గారు